So what are my objectives for you today? It's really just to empower you. I want to go over the ABCDEs of melanomas, and I know that a lot of you have heard about the ABCDEs before, but it's really a very useful tool. I need your help with this too, because I need you to do one exercise, and that is to put your hand up, because there's going to be a few questions. I just want to make sure that you are listening. I'm going to talk to you about some sun care tips. And then finally, just how can we take care of ourselves when we have a diagnosis of melanoma. So getting into the ABCDE tool, what is it? It's a tool to help you check your moles. It's a very good tool. It's a tool that's useful if you don't have melanoma to help you check your moles. And it's also even more useful perhaps if you do have melanoma, because as you've been told earlier today, if you do have melanoma, you are running a risk of about 10% greater than the general population of developing other melanomas. So it's really good to know the ABCDEs and to be doing them. Sometimes moles will change into a melanoma, and this is why your moles need to be monitored. Not all moles are going to change to melanomas, however, but they do have that potential to change, so we need to check them. Sometimes melanomas just pop up on their own, unfortunately. So each letter stands for a characteristic within the melanoma, and melanoma may have some or all of these characteristics. So the A is for asymmetry. So on each side, I'm going to be comparing with a normal mole, because we don't know what melanoma is or potentially is unless we understand what a normal mole looks like. So always on your left are going to be the normal moles, and always on your right they're going to be examples of the melanoma, and then the A is, the different letters are going to be the characteristics within the mole that we're going to be checking. So a normal mole is kind of like a circle, and if you cut it in half, one side equals the other side. So it's known to be symmetrical. But melanoma is not like that. Melanoma tends to jut off in one direction. It is known to be asymmetrical. First question, that's where I want you to put your hands up to help me. How might you describe what an asymmetric mole looks like? Anybody? Sure, lady in the green.
It's different on the two sides?
That's right. One side doesn't equal the other side. It is asymmetric. Thank you. B is for border irregularity. So on the left is the normal mole, and on the right the melanoma. The normal mole, basically the border, if you go around it, it's regular, whereas the melanoma mole is a jagged, irregular border. You can see that. As we go around, you can see the border is not equal or regular. C is for color. That's an easy one to remember, I think. So the normal mole on the left is one color, whereas the melanoma mole may have many colors within the mole. So looking at your moles, it's really worth a second check to check your moles. Check deeply into your skin, into the moles. And you can see that the melanoma mole could have many colors within it. It could be dark brown, black, red, purple, white. Different colors within the mole could be indicative that there's something going on with the mole. D is for diameter. Now normally, a normal mole is no bigger than the end of a pencil eraser or end of a pen, or 5 millimeters in width, where a melanoma mole can be much larger than that. So D for diameter is one of the signals of what to look out for. Now E is for evolving. Now I think this is probably one of the most important characteristics within the mole to know about. E for evolving, because E means change. And for a lot of people, this is the first signal that something wrong might be happening. And for some melanomas, it might be the only signal that something is happening, that the melanoma is there. So I think it's probably the most important of all the ABCDEs is E. E means change. So if you notice a mole that is changing in any way, for example, in size, shape, color, oozing, bleeding, itching, please notify your healthcare professional as soon as possible so we can look into it and check it out for you. So here's where I want you to put your hands up. What does the E and the ABCDE stand for? Evolving. Thank you. That's correct. Okay, now maybe a little more difficult. Can anyone describe 3 changes within your mold that you'd want to bring to your healthcare team's attention? Color, size, shape. Any other things? You're listening. I'm impressed. Thank you. Okay. Now, how do we begin? You've got a moldy body, and you want to make sure that you're safe. So, first of all, pick a specific date to check your moles every month. For some people, it might be your birthday, it might be an anniversary, but for some people, I just say, just take 5 minutes. Take 5 minutes on the 5th of every month. And when you come out of the shower, if you have hair on the top of your head, check your hair when your hair is wet and stringy for any changes or any moles. Right down your body, right down to the soles of your feet, between your toes. Check on your nails. Check for any changes from top to bottom. That's another thing about change. You don't know if it's happening if you're not in the habit of checking. So you really got to get to know your skin and your moles. Second thing is, teach a friend the ABCDE so that they can help you check your back, or learn how to use 2 mirrors. A person was asking earlier in the day, how do I check my back? Well, it's basically using a couple mirrors and checking your back and just getting to know what's on your back and be familiar with any changes when they happen.
My wife's better.
Yes, a friend or a wife's better, and then you're passing the knowledge on and more people are learning. So I agree. Okay, the second part is sun care. So how can we protect ourselves from the sun and UV exposure? So this slide just goes through it all. You want to avoid the sun when the sun's at its highest between 10 or 11 to 4 p.m., especially in the summer months. And another thing I want to add, in the summer you want to be careful with the sun reflecting off the sand or the water because you can get burnt a lot faster and a lot easier. And in the winter, the sun reflecting off the snow can get you burnt a lot faster. So you want to be careful in those incidents. You want to use a sunscreen with an SPF of at least 30 or greater. And with the new targeted therapies that Dr. Petrella was talking to you about, maybe even a sunscreen with an SPF of 60 or better might be helpful, because with these special drugs and these new treatments, you can get burnt a lot faster. We've had patients tell us they've got burnt just getting from our center to the parking lot. You want to apply the sunscreen every 2 hours while you're outside, starting from before you go out, after you go out, and then every 2 hours thereafter. So that means you have to bring the sunscreen with you. You want to wear wide-brimmed hats that are tightly woven, not the ones that have holes in them. Wide-brim hats with tightly woven. Sunglasses with UVA, UVB protection in them that wrap around your face to protect the side of your face. You can buy clothing with UVA, UVB protection built right into it. We know now that it's dangerous to attend tanning salons, that they do cause skin cancers and specifically as well as melanoma. So never attend tanning salons. Teach our children not to do that either. And we want to learn the ABCDEs of melanomas. So sun protective clothing, what is it? So really it's just clothing that was built with a sun protective factor built right into the fabric. It's useful when applying sunscreen. It's difficult. For example, if you have a wiggly, jiggly child that won't sit still. Sprays that have with SPF factor for children that won't stand still are useful as well. So you could still use the sprays. But it's good when you're living an active lifestyle, such as jogging, golfing, swimming, etc. So 2 helpful websites or www.sunveil.com that you can look up, and also www.uvskins.com. And I know, I'm looking up that website, if you purchase $50 or more, they will ship free. So basically, how can we take care of ourselves? In the beginning, and right from the very start, you need to know how to get in touch with your healthcare team. You need to know who your doctors are, who your nurses are. Understand that if you have plastic surgeon, what they do versus what your surgeon does. It all will help you when you have a question. And now, especially in the time with these new medications, new combo drugs that Dr. Petrella was talking about, we want you to report any new symptoms or concerns that you have. We don't want you to wait until your next appointment. I just want to tell you about one of my patients, Mr. Z. He called me up and he said that he's a lawyer, and he said that he wanted to be referred to neurology. He said he's having trouble lately with his memory and with focusing and remembering words. So I became very concerned with that, and I got him into clinic that day. And we ordered a CT scan of his head on him that day. And he went on the next day or the day after to have brain surgery to remove his brain metastases. I can report that Mr. Z is still here with us today, and he has good quality of life. So it's very important to let us know sooner. Don't think that you can wait to your next appointment before you report your new symptoms, especially now with the new combo medications. And then, of course, if you have melanoma, or even if you don't, it's always important to get routine skin checks by your dermatologist. Final thoughts. We're well aware that melanoma affects both you and your loved ones. You know that we are here to help at the center. It's not just the doctors, the nurses, it's the occupational therapists, the psychologists, the psychiatrists. We're all here. We're here for you, and we want to help you. Know that you're not alone. Well, today, looking around in this room, obviously we know by being together today that you are not alone. And finally, you are the center of the healthcare team. So the most important member of the healthcare team is you. Thank you.